Restarting Ozempic, Semaglutide, or Mounjaro, Tirzepatide after stopping is often possible, but it rarely feels like a clean resume. Many people need a lower restart dose, a slower climb, and more patience than they expect. The drug may still help. Your old tolerance may not still be there. The second start can feel easier or rougher for reasons that are predictable. Some people stop because of surgery, cost, travel, supply problems, or side effects. Others stop after losing weight and assume they can come back later using the same dose and the same routine. That is where many restarts go wrong. A short gap and a long gap do not behave the same way. These drugs slow how fast your stomach empties and lower appetite signals. After you stop them, those effects fade and your body can lose the tolerance it built during steady use. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. That explains why a restart after a brief interruption may feel fairly familiar. A restart after several weeks can feel much closer to starting over. The medicine did not change, but your body may no longer be adjusted to the dose you handled before. Many people focus on the wrong question first. They ask whether the drug will ever work again. In real life, the better question is simpler. It is whether you are restarting in a way your body can tolerate long enough for appetite control and weight loss to return. Tolerance means how well your body handles the medication without getting overwhelmed by side effects. That includes nausea, reflux, constipation, early fullness, and sometimes fatigue. Jumping back to the old dose too quickly can bring those problems back before appetite control has time to rebuild. Timing also fools people. The first few days after a restart do not tell the whole story. Comparing day 3 of the restart with month 5 of the first run sounds reasonable. It is not a fair comparison. Another common mistake is reading weight regain the wrong way. Regain after stopping does not automatically mean the drug stopped working forever. Appetite often rises again when the medication is gone. A restart may still help, but the second round usually needs a calmer setup. People also forget that the body you restart in may not be the body you first started in. Sleep may be worse, meals may be more chaotic, stress may be higher. Those changes can amplify symptoms and make the restart feel harsher than expected from the medication itself. That creates two very different restart groups. One group stopped for practical reasons, like travel or a refill gap, and may restart without much fear. The other group stopped because side effects were miserable. They often restart tense, underfed, and hyper-aware of every stomach sensation. A third split matters too. Some people were off for only a brief stretch and may still be partly used to the drug. Others were off for weeks or longer, and the old dose may now act like too much medicine too soon. That is one reason copying the old plan can backfire. Panic after weight regain can make the restart feel worse than it really is. What feels like the drug failing is often panic pushing people to expect results before the body has adjusted to treatment again. People regain weight, rush back in, and expect fast relief. They may also eat irregularly and drink too little. Then, they may blame the drug alone, even though the restart pace and eating pattern can also be part of the problem. That is why the second start often feels more emotional than the first. Fear and urgency push people toward faster, rougher decisions. Certain people deserve extra caution before restarting. That includes people who stopped after severe vomiting, dehydration, repeated fainting, or severe abdominal pain. It also includes people whose clinician worried that a serious medical event might be linked to the medication. In those cases, the issue is not just when to restart, the issue is whether restarting is appropriate, what dose is reasonable, and whether the original event was fully evaluated. A plan that makes sense after travel can be unsafe after severe vomiting, dehydration, or severe abdominal pain. What helps most is usually less dramatic than people expect. Dose selection, slower escalation, hydration, smaller meals, and enough protein often matter more than motivation. People want the old effect back immediately, but safer restarts usually begin with lower ambition and better control. 3 questions can make the restart plan clearer. How long were you off the drug? Why did you stop? What happened at your last dose increase? Those answers usually help you decide whether you should restart near the old dose or restart at a much lower dose. The body signals that matter are usually not subtle. Inability to keep fluids down deserves medical attention. Repeated vomiting, worsening dehydration, severe belly pain, fainting, or symptoms far worse than your first start also deserve attention. Mild fullness can happen. Escalating symptoms should not be brushed aside. Another warning sign is when normal daily function starts to break down. Trouble drinking, trouble eating small meals, or trouble getting through normal daily activity all matter. When those appear, the restart is not going well. Potential future weight loss does not cancel the need for safety right now. A surgery-related pause needs extra care before restarting because food intake, hydration, and gut function may still be unstable. Restarting too soon after a procedure can worsen nausea, reduce food intake, and make recovery harder. The body usually handles a restart better when eating, hydration, and recovery after the procedure have clearly stabilized. Meal behavior matters during the restart. Large meals, fast eating, alcohol, and low fluid intake can make people think the medication is suddenly impossible to tolerate. Sometimes the restart plan is not failing. The real problem is eating in a way that overloads a stomach that is emptying slowly again. Expectation control matters too. Appetite may not quiet down in the first few days. Weight may not respond immediately. That delay does not automatically mean the drug has failed. It often means the drug is building back up in your system while your body adjusts to it again. The smartest prevention step is keeping a clean record before you restart. Write down the last dose you used, the date you stopped, why you stopped, and which symptoms appeared at each dose. That turns the restart from a guessing game into a clearer plan. Separate 2 goals. One is getting back on the medication. The other is staying on it long enough to tolerate it and benefit from it. Another prevention step is avoiding the toughness test. People get into trouble when they try to prove they can still handle the old dose. They may ignore dehydration or force normal-sized meals too quickly. A careful restart may look less impressive for a week, but it often performs better over months. So what should you expect if you restart after stopping? In many cases, expect that the medication can still help. Do not assume the old dose, the old timing, or the old tolerance are waiting for you. The second start often goes better when you restart more carefully, with slower pacing and sometimes with a lower dose. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.